Hello everyone. My name is Ryan, and I'm gonna be doing the healthcare system in Brazil for this discussion. I chose Brazil because I've always wanted to travel there. So Brazil's healthcare system is universal, unlike the United States. Any legal citizen, including foreign residents, are entitled to free health care at a public hospital or clinic, meaning like if you're an international student, you're able to receive this free health care. It's government funded, and they have this ministry known as the Ministry of Health, which is responsible for the public health services, the government, hospitals, and the medical services. Brazil has this card, it's called SUS, and with the SUS, each person in Brazil has one, and it has basically all their information on there. So when they do go to the hospital, they're able to pull up their records based off of this card that they have. It's kind of like the VA hospital, meaning like they don't have to pay fees for labs, for doctors, for surgery, for prescriptions. This is available not only for the people who live in poverty in Brazil. This is even for the wealthy. But most of the wealthy people in Brazil, they have their own insurance that they pay for, their private insurance or the insurance they get from their employer. But they're still able to use the free public health care system when they want to. So what happens is, say they have a very expensive procedure that needs to be done, they would go over to the free hospital and get that done there instead of coming out of pocket and paying or having their insurance company pay for that, where their insurance will increase. Based off the information that I found, 70% of Brazilians use public hospitals. So that means like only 30% are using the private hospitals, or they're paying for them. They're paying for it for themselves. The difference between the private hospitals and the government-funded hospitals is that the government-funded hospitals have a longer wait time, and they do receive good health care, but it's not at the same standards as if you went to a private hospital. Based on the information that I found, some people say that the wait times is not comfortable. There's no air conditioning, and they're kind of feel like they're not treated as good as if you were at a private hospital. But they do not complain about the free health care, the free prescriptions, and all of that. The last thing is that based on 2016, Brazil only uses 9% of their GDP compared to the United States. We used 18%, and it increases all the time. So I'm pretty sure we're probably at 20% now, GDP for healthcare. One thing I would say is that the good thing about Brazil is that everyone can get this get this free healthcare regardless of standing in what's the word? I don't know. Oh my god. Based off where they are on the poverty scale, everyone can receive this health care, and they have the option not to do it. You don't have to, but the fact that everyone has the option regardless of how much money they make is a good thing. And that is all.